with that set up, let's talk about what is a VO2 max test.
All right, so the original concept of volume of oxygen, or that mammals consume oxygen, is the difference between the room air oxygen. When it goes into the mammal and comes back out, you eat some of it, and that's called oxygen consumption. And the oxygen is either at the mitochondria, which inside the muscle, so your heart doesn't, it pumps it to the whatever you're doing. And inside the muscle says, I have oxygen coming here, and I've got fuels, carbohydrates, or fat. I'm going to eat the oxygen to stay alive. So we can do VO2 at rest and simply call it a VO2 test. We can do it on an active person. As they increase work, we can say they're going to eat more oxygen because they're doing more work. The great thing, that the simple finding that makes sense, is that oxygen consumption, which again would be calories per minute, goes up linear with work if the workload is linear. So when you say a treadmill test, the protocol needs to be increasing linear at a time. So in other words, strength test, 5 pounds, 10 pounds, 15 pounds, 20, 25, 30. So it's linear, it goes up. Then your heart rate goes up linear, your oxygen consumption goes up linear. And you can see then test, retest, is your heart rate lower at the same workload than last year? And you go, well, how did they get lower? You say, well, you're better at consuming oxygen. Your heart rate goes lower because you have more blood delivering. So it is complicated, but there's really two tests. One is using VO2 to look at calories per minute, and then looking VO2 in a stress test to compare the fitness changes, or what has changed across time. The most important thing in that is to use the protocol or the type of device, the exercise piece, treadmill, bike, elliptical, that the person is most familiar with. Because the training effect that you bring in across the year is done at the muscle of what you're familiar with. So Greg LeMond, Tour de France winner, would be terrible on a treadmill relative to himself. He'd still be in pretty good shape. But you go, well, his heart doesn't know he's on a treadmill. Heart doesn't know he's on a bike. His lungs don't know. But the skeletal muscles that are saying, feed me the oxygen, I will consume it, our cycling muscles are unique because he's been training them. He's familiar with them. So the oxygen consumption is based on the familiarity of it. And that's why most people rely on a treadmill test for John Q. Public, because they all generally walk.